Hi, everyone. It's Dr. Watkins here at Living Wellness Medical Center in Phoenix, Arizona. If you guys can hear me, would you just type in yes in the chat box? Okay, I'm getting a thumbs up that you guys can hear me. Awesome. So hello, friends. Happy Friday. I hope that this is finding you all well and in good spirits. We made it through another week, another month, and I'm really excited to share with you all the second part of this 3-part webinar series that I've been hosting, discussing the different reproductive phases that a woman goes through in her life. Today, we're going to be talking about the obstacles to fertility. We're going to talk about some common conditions and risk factors that can contribute to infertility, and then some things that we can do in clinical practice and things that you can do outside of the doctor's office if you happen to find yourself on this journey. I wanted to mention before we start that here at Living Wellness Medical Center, we do offer a free 10-minute meet and greet for prospective patients. This is an opportunity for you as a patient to express some of your health concerns to me, and then in turn for me to give my treatment approach and to see if we're a good fit for each other. You can schedule that free meet and greet via our phone. So calling the front office, our number here is 480-588-6856. Or you can schedule that free meet and greet online at our website, livingwellnessmedicalcenter.com. So yes, we're here on the second phase of the webinar series. I'm super excited to talk about fertility and our naturopathic approach to this topic. So let's dive right in. Okay, so first things first, what do these words mean? So these are Latin words, which means treat the total person and treat the root cause. These are 2 naturopathic principles out of the 6 principles that really guide how we approach clinical practice as naturopathic physicians. I like this photo because you can see this beautiful tree, but you also see its root system. And this is a really good way to represent the human body. The tree and the leaves, that is our physical body. That's how we're manifesting physical symptoms, whether it's infertility or hair loss or irregular periods, or maybe just a healthy, vital being. That's what our leaves and our branches look like. But what's causing how our leaves and our branches to grow is what's happening within the root system. This is really important when we talk about complex conditions such as infertility, because there's so many different branches that can contribute to fertility in ways that we can address this topic. So I really like to just open up the conversation with this. You will hear me say this over and over and over in every webinar. We have to treat the whole person and we have to treat the root cause. That's how we find true healing and we see true results. All right, some facts here. So medically speaking, what does infertility mean? For a woman that's 35 years old or younger, infertility means trying for a pregnancy and being unsuccessful after 12 months of trying with frequent intercourse and without any contraceptions or contraceptives. For a woman that's 35 years old or older, this time frame is 6 months of frequent intercourse without contraceptives and the inability to get pregnant. So that's how we define it medically. 1 in 8 couples in the United States alone are affected by infertility. Around 10 million couples seek infertility services every year. This number is increasing. 40 to 45% of infertility cases come from female cases or causes, and 40% come from male causes. This is really important, and we're going to dive into male infertility towards the end of the webinar, but I really like to show these statistics so we can start to have more of a well-rounded conversation around infertility and start to change the narrative that we've seen over the last, decades of years around infertility. 10% of cases are unexplained, and 5% are from really rare causes. Usually these rare causes are from genetic abnormalities. And we'll talk a little bit more about that too as we move on. All right, medical history. So here are some of the questions that as a medical professional, I want to know when I'm assessing someone for infertility. But these are also really helpful for you as a patient to know these things too, because it helps you to start to tie in or connect dots between things that may have happened to you in your medical history and what you're experiencing right now in the current time. So prior pregnancy history. Has this patient ever been pregnant before? If they have, did they have a successful pregnancy? Do they have a history of miscarriages? Have they ever been pregnant before? These are things that I want to know as I'm assessing someone. Menstrual cycle history. What are their periods like? Are their periods regular? Are they irregular? Are they having a period? Do they have heavy bleeding with the period? Is it a painful period? If they're on birth control, what method of birth control are they on? How long have they been on the birth control? If they've just stopped the birth control, how long have they been without it? And what do cycles look like with and without that influence? Coital frequency. So how often are they having sex? Are they enjoying the sex? Is it good sex? Is it, are they thinking about becoming pregnant during the sex? Those are questions that I'm asking. Surgeries, hospitalizations, any chronic illnesses or autoimmunity, any history of sexually transmitted infections, and then their PAP history is important. Current medications, past medications, allergies. Does this person have allergies? And if they do, are they experiencing these allergies every single day? Over time, this can really affect our body in its way in performing optimally. Family history. This is also really important. Is there any congenital birth defects within the family line? What are the chronic conditions that we see on paternal and maternal sides? And what does the reproductive health look like from a family perspective? Lifestyle. So is this person a smoker? What does their alcohol intake look like? What does their diet look like? What's their poop look like? What's their stress load? How are they sleeping? What's their exercise like? What is their relationship with their partner? All of these things are really important as we start the process of figuring out why our patient, let's just say our patient, isn't having a successful pregnancy or are able to maintain that pregnancy. These are all things that I'm looking for. Clinical approach. So I've broken down different factors of infertility into these 6 categories. I want to note that there are way more categories than this. Okay, fertility is a very, very complex topic. There are several different compartments and different limbs that contribute to a person's fertility, but for time's sake, I broke it down into these 6 major categories. So structural issues, hormonal imbalances, environmental toxicants, nutrition, stress management, and then male infertility. All right, structural. So structural infertility or causes to infertility is when the actual reproductive organs are affected. This is the ovaries, the uterus, the fallopian tube, the cervix. So when there's an actual physical deformity or abnormality within the gland and the organs that are important for pregnancies. So any infections, either from sexually transmitted diseases or septic abortions, any growths or tumors, so cysts or polyps, fibroids, endometriosis, even the position of the uterus is really important when we're assessing for infertility. Surgical history or trauma. Has there been any abdominal surgeries or any traumas to the abdominal or the pelvic space? C-sections is really common. These are abdominal surgeries. And with surgeries, we always have scar tissue or adhesions. This can cause some issues when we're talking about fertility if there's extensive scar tissue in the abdominal or the pelvic region. Pregnancy history. So again, has this person had any history with ectopic pregnancies or have they had frequent abortions? This can also cause trauma to the pelvic or the abdominal area. And then genetic abnormalities, which we talked about before. They're very rare, but they do happen and they're important for patients to know. So this little picture here, I like this because it shows you the different type of structural abnormalities that you can have. Now, this isn't nearly all of them. This is not an exhaustive list. This is just showing you the most common things that we see in clinical practice. I'm going to pull up my whiteboard here so that I can point and that you guys can see. All right, so right here, this is called a fallopian tube blockage. So right here, you'll see this little area. There's a blockage within the fallopian tube. This can happen through inflammation or scar tissue, any ectopic pregnancies. The egg can't travel through the fallopian tube into the uterus where it needs to be. So that's a common cause. Uterine fibroids. This fibroid right here is actually within the uterine wall, but there are several different types of fibroids. Right here, we're shown endometriosis. This is when uterine lining is actually outside of the uterus. This can cause very painful periods. It can cause adhesions and scar tissues and definite issues with infertility. Tubal infections. So how does sexually transmitted infections affect my infertility? This is how. We can have infections that move from the vaginal canal up into the uterus, through the cervix, into the uterus, into the fallopian tube, which can cause inflammation and then affect fertility. So those are just some common structural things that we see in practice that can really inhibit your ability to become pregnant. I also want to encourage you all that if you have any questions, we will allocate some time towards the end of the webinar to discuss questions. Just put them in the chat box as we go along, and I'll make sure to get to them later. All right, so how do we treat these structural abnormalities? So number one, if they are a condition that is driven by hormones like fibroids or endometriosis or ovarian cysts, cervical polyps. Those conditions usually have some type of hormonal influence that is encouraging that growth. So if that's happening, we want to make sure that we're addressing those hormones first. And we do that through lifestyle and nutrition. So what is your life like? Are you a sedentary person or are you an active person? What does the mental and emotional health look like? Is there stress? Is there anxiety? Is there depression? How does this person feel about their bodies? Nutrition and supplementation, either through giving the person hormones to help that hormonal imbalance or giving them other nutrients to help them throughout that process. Those are some ways that we can address the hormonal side. How do we address scar tissue and adhesions? So microcurrent is a really helpful way. This is a type of treatment that uses different currencies and frequencies to change scar tissue and cellular structure within the body. So this can be very helpful. It is a totally non-invasive treatment. You don't even feel that something's happening, but this can be really helpful for scar tissue and fibroids and endometriosis. Soft tissue manipulation, so uterine massages can be really helpful for this, abdominal massages to help break up some of that scar tissue. Proteolytic enzymes, these are enzymes that break down scar tissue and different proteins. Ask your doctor about this. There are several proteolytic enzymes and they have a whole list of functions, but this is something that I use in practice. And of course, surgery. So obviously, as a naturopathic doctor, I want to do the most less invasive procedures possible. However, I think it's important to note that with some conditions, we can only get so far with our naturopathic tools. Some things are a little too far gone to really put a dent in it with natural modalities. So it is important to note that surgery can be very helpful and can be necessary depending on what your situation is. And there are things that we can do to help support you before surgery and then after surgery so that your body is supported as much as it can be if you have to go through a procedure to remove some of the structural abnormalities. All right, so now we're moving into more of the hormonal side. So we have the structural side that can have issues that can cause infertility, but now we're talking about hormones. So what hormones are affected with women whenever we are approaching the topic of infertility? So LH and FSH, these are those two hormones that we talked about extensively in the first part of the series, of the webinar series. LH and FSH is very important in dictating our cycles. So how we mature an egg, when we ovulate that egg, and then what happens to the egg and the uterine lining after the egg has been ovulated. Estrogen, progesterone, testosterone, TSH, so one of your thyroid hormones, DHEA, which is an adrenal hormone, and sex hormone binding globulin, just to name a few. These are all hormones that are very important when we're assessing infertility. And I want to note here that these two pictures are basically showing you the same thing in two different ways. So for those of you that were with us on the first part of the series, you may remember me talking about that three-step pathway. For those of you that were not there, I just want to give you a quick rundown because this will help to make sense of what these pictures mean. So we have a part in our brain that's called the hypothalamus. I like to think of this as the mastermind of the endocrine system. And the endocrine system is just a system that involves hormones, and then those target organs that our hormones tell what to do. So the hypothalamus is where it all starts. The hypothalamus then sends a signal to another part of the brain called the anterior pituitary. And the anterior pituitary is like the grand central station. Its job is to release another set of hormones that then go to our final destination, which is our actual organs. So the ovaries, the breasts, the adrenals, or the thyroid, that's our final destination. This is why the pituitary is so important, because without those other hormones to tell the organs what to do, we don't have any function. So this is how we assess that hormonal three-step pathway. What hormones are off and where are they off? Okay, so some conditions that we see with the hormonal imbalances and infertility. So amenorrhea, which is the absence of a period, or oleomenorrhea, which is a prolonged cycle, so cycles that are 35 days or longer. A very popular topic in that realm is PCOS, and we'll talk about that a little bit in just a second. The luteal phase defect, which is the second phase of the cycle, so issues within that cycle. Ovarian insufficiency, which is more in the first phase of the cycle, hypothyroidism, and then obesity, insulin resistance, and diabetes. These are all hormonal conditions that affect fertility. So PCOS, polycystic ovarian syndrome. I think I'm going to do a whole nother webinar series that just really dives in on PCOS because I'm getting a lot of feedback from women wanting to talk about PCOS more. This is becoming a more and more common condition that we see in practice, and it's really important that we talk about it, especially when we're talking about infertility. So some of the things that we see clinically for PCOS is elevated androgens, which is DHEA and testosterone. They're types of hormones. Elevated estrogen can also be really common, and then suboptimal progesterone. So again, that estrogen dominance picture. We could have a lot of estrogens and a lot of testosterone and DHEA, but not enough progesterone to really balance those hormones. And ovulation, so this just means that the person isn't ovulating. If you're not ovulating, we're not releasing an egg. That means that the egg isn't going to the uterus to wait for implantation and fertilization, and this is what causes infertility, particularly in PCOS. Insulin resistance is a really common variant of PCOS, along with diabetes and obesity. So making sure that we address those factors whenever we have a patient with PCOS. And then taking account for the stressors that this person may have, whether it's financial or mental, emotional, physical stressors. Is there any other inflammation or processes in the body that's causing stress? And then the environmental burden. So what external factors or pressure is being put on the body from the environment? All right. Luteal phase defect. All right, guys, so let's look at this picture here. This is a refresher from the first part of the webinar series. If you weren't there, we'll go through it again now so that this makes sense. So the first phase of our cycle is the follicular phase, okay? In the follicular phase, we are maturing our follicle. This is the egg. That's all that we're doing. During this phase of the cycle, estrogen is on stage, okay? This is a time for estrogen to really shine, to really stimulate that follicle so that it can be ovulated. After the egg is ovulated, we go into our second phase, which is the luteal phase. Estrogen is still on stage, but she's taking a co-lead role. At this time, progesterone should be the star, okay? This is important in understanding luteal phase defects because of progesterone's job. Progesterone's job is to maintain that uterine lining and to help it to continue to mature, to be nice and plumpy and have a lot of blood supply so that that egg can implant and once it's been fertilized by the sperm. So in a luteal phase defect, menses are usually starting a little bit early because this phase is cut off, is cut short. And typically, women see some type of spotting before their menses. Again, because that luteal phase is not, it doesn't have the space to have a full cycle. It's cut off a little bit short, which is why we see some of that bleeding. We don't have progesterone to maintain that lining. And if you think about the word progesterone, it has progestation in the word. So it wants to support pregnancy by maturing that lining. In a luteal phase defect, we're not having that happen. So we have suboptimal progesterone. We don't have enough. So we don't have enough progesterone to maintain that lining for fertilization and implantation. So either we're not producing enough progesterone or the uterine lining isn't responsive to the progesterone that we are producing. Okay, we see this with elevated prolactin, which is another hormone that's made in the brain. This hormone is commonly elevated in women under high amounts of stress. PCOS can cause this to happen, and hypothyroidism can also cause this to happen. So this is issues in the second phase of the cycle. In primary ovarian failure, this is issues in the first phase of the cycle, and this is when estrogen is doing her thing, okay? So we call this early menopause. This is for women 40 years or younger whose ovaries have started to decline prematurely. What this means is that we don't have enough estrogen to either help mature the follicle or to release the egg once it is mature. Symptoms that we see with primary ovarian failure: low sex drive, hot flashes and night sweats, irregularities within your menstrual cycle, painful sex, and vaginal atrophy. A lot of these symptoms are also present in our perimenopausal women. Why is that happening? Because estrogen is starting to decrease. And that's one of our pivotal changes in our hormones as we start to transition into menopause, is that we lose estrogen. And that's when we see some of those symptoms. So we also see those symptoms in primary ovarian failure. Thyroid disease can cause this. Exposure to radiation or chemotherapy can also cause this. The radiation piece is really important, especially when we're talking about patients who have high exposure to radiation in their jobs. So flight attendants or pilots, people who work in the airport, particularly with security and the screening processes, radiologists, techs, dentists, dental hygienists, all of these people have regular exposure to radiation, which can cause the ovaries to decline prematurely. Environmental toxins, which we'll talk about much later, can also cause this to happen. Infections, genetics, and autoimmunity should also be ruled out and considered whenever we're working these things up. All right, so what are some ways that we can treat primary ovarian failure? So I will admit that this can be a little more difficult to treat. But there are some different ways that we can approach this. And with naturopathic treatment, the beautiful thing about what I do is that I get to be really creative about treatments for my patients. No one body is alike. So I could have 5 women who are dealing with infertility. Every single woman will have a very different treatment plan. We may have some similar themes, but the treatment is going to look really different. So there's never a time where I'm just doing one of these things. It usually looks like a combination of several different things to make sure that we have a really comprehensive treatment plan. So herbs, I love to use herbs for every condition. Herbs can be really helpful. They're gentle and they take a little bit longer to work, but they do work. Micronutrients, so making sure you're getting all of the vitamins and the antioxidants and the minerals that your cells need to become pregnant and to maintain a healthy and safe pregnancy. Supporting the adrenals and the thyroid is super important. This has a lot to do with our metabolism. Our thyroid affects every cell in the body, so it's super important that that is balanced. And getting pregnant and maintaining a pregnancy, that's super important. Balancing the nervous system. How is the sleep? How is the stress? That's pivotal. Whole foods diet, so we want to decrease inflammation and we want to increase the nutrient intake to make sure that we're getting all those micronutrients that we just talked about. Hormone replacement therapy can be helpful, so actually giving the woman estrogen or giving her medications to increase her internal production. IUI, so intrauterine insemination, this is when we actually get sperm and we insert that straight into the uterus to help with the fertility process. Or IVF, which is in vitro fertilization. This is when we take eggs and we take sperm and we do the fertilization in a test tube, and then we put the embryo back into the uterus. So those are two different ways that we can treat this as well. And then identifying any other causes and then treating that accordingly. So again, treating the whole person and treating the root cause. Environmental exposure. So this is really juicy. As our environment continues to become more and more polluted, we will continue to see difficulties with fertility, increases in autoimmunity and inflammation, autism, dementia, breast cancer, you name it. There's a ton of conditions that are really affected by our environmental exposure. So how do we get these exposures and what are they called? These groups of chemicals are called endocrine disruptors, meaning they disrupt the endocrine, the hormonal system. So bisphenols, BPA is the most popular one. We find BPA in the linings of cans. So canned foods, make sure that if you're getting canned foods, you're looking for cans that are BPA free. Sales receipts has a lot of BPA. Also, plastic bottles have a lot of BPA. Plastic is one of the highest forms of exposure for BPA. Phthalates are in food packaging, so those plastic wraps that we get with our produce or our meat, they put it in toys and in plastic so that it can help the plastic to be more flexible. Footwear, medical plastic tubing. So for me, a medical professional, I'm always in contact with different plastics that we use here in the office. That's a form of phthalates. And personal care products, so makeup and lotion and hair care products. And a lot of conventional or popular products, they're ridden with these phthalates, which can really disrupt our hormonal system. Parabens, also found in food and cosmetics, pesticides, herbicides, insecticides. So our big farmers, we want to have a huge crop. We want to be able to harvest a lot of our crops. And the ways that they do that is by spraying the pesticides and the herbicides. So it helps in keeping the bugs away, but it really hurts our bodies because those chemicals start to leach into the produce that we then eat. This is why it's important to buy organic whenever you can. And then heavy metals, so aluminum, arsenic, cadmium, chromium. Aluminum is found in a lot of deodorants. A lot of conventional deodorants have aluminum, so make sure you look for aluminum-free deodorant if you can. Smoking is a huge exposure. Air pollution, we have a ton of it here in Phoenix. Unfortunately, we're in a valley, so a lot of the smog gets trapped here. Dental fillings, contaminated food and drink, and then just being in contact with industrial products like petroleum or oils can really increase your environmental exposure. Here are some tips on how to reduce your environmental burden. So washing your produce, this is really important, especially if you can't shop organic. Doing a quick wash of your produce can help rid some of the pesticides and the herbicides that sit on top of the produce. If you can, skin some of your produce. So apples are really high in pesticides and herbicides. So if you can't get organic apples, making sure that you remove the skin so that you at least get that first pass out of the way and decrease your exposure. Buying less processed and packaged foods can be really helpful. If you like fish, go for wild caught fish instead of farmed fish. There's a ton of mercury in fish. Grass-fed beef is important. Hormone-free meat or hormone-free eggs, cage-free eggs. These are other ways that we can protect ourselves and our food. Avoiding plastic foodware and heating plastic. So Tupperware, Try to use in glass instead of the plastic, and never, ever, ever, ever heat your plastic Tupperware or plastic plates. That's a no-no. BPA-free water bottles. So I like water bottles just like this. These are stainless steel. They are BPA-free within the lining. This is really helpful for the environment because it decreases the plastics that we use, but it's also really helpful for your body because you don't have that daily exposure of BPA that you would get through a plastic water bottle. So I recommend these for everyone. Air fresheners and perfumed products. So like the Glad or the Febreze that we like to use to freshen up our spaces. These can be another form of exposure to environmental toxins. And then cleaning products. So here are some really good resources that I really like to use with my patients and that I personally like to use whenever I'm looking for products. So the Environmental Working Group is amazing. They actually have apps that you can put on your phone that helps you to screen your cosmetics, your water products, your cleaning products, sunscreen, insect repellents, and other endocrine disruptors that are commonly found in our environment. This is how you can screen those products from the comfort of your iPhone, okay? They do a lot of good work here, and they help to rate certain products. So you can see this is a really clean product, and this is a not so clean product. And then it helps to list why a product is clean and why a product isn't clean. So it just continues to support that education around being more aware of what's in our environment. The National Association of Environmental Medicine is also a really great resource. This helps you to find other physicians who are really versed in environmental medicine, and they also provide a lot of educational resources, so webinars and conferences and handouts. This is a great resource for you to further educate yourself on environmental burdens. Nutrition. So we talked about nutrition a little bit before, but we're going to go into it more here as far as what I'm looking for in a diet in a woman that's trying to get pregnant. So number one is fat. In America, we've demonized fat for the last 50 years, which is really unfortunate because fat is important. It just depends on the type of fats that you're getting. Why is fat important? If you look at the bottom of this slide here, you'll see this pathway where there's cholesterol and DHEA and estradiol and cortisol. This is a hormonal pathway that shows how hormones are made in the adrenal gland. The very, very, very first step is cholesterol. We need cholesterol to make our hormones. This is why fats are so important. If we don't have fat, we can't make the hormones that we need to support our fertility and to support our other functions in the body. It's also really important for our cellular activity. Our cells have a fat layer. It's called a bilipid phospholipid bilayer, which is made of fats on the outside of our cells. This is how our cells communicate with each other. If we don't have that healthy lipid bilayer, our cells don't do a really good job of communicating and carrying out their function. Protein. Protein is super important. It's important for metabolism. It's important with blood sugar. It helps to maintain blood sugar so that we're not having these spikes and these dips, which can be really preventative for diabetes and insulin resistance. It also helps us to maintain a healthy weight, which is healthy in pregnancy. We don't want our weight to be too low, but we also don't want our weight to be too high. So protein can help to target cravings that we have by keeping our blood sugar normal, which will then help us to not crave empty calories, like carbs or chips or chocolate or all the other yummy things that can cause us to have differences or fluctuations within our weight. Fiber. Fiber is super important because it encourages those healthy lipids. Again, it's really protective for the heart by supporting healthy lipids, and it's healthy for our gut. In our first part of the webinar series, we talked about liver's role in helping hormones to stay balanced. Another way that the liver does this is helping us to get rid of excess hormones through our stool. This is where fiber is important. If you are constipated, if you are not getting rid of excess hormones in your body through your stool, then they start to accumulate, and this is how we start to see other hormonal imbalances. So fiber is important in this way because it encourages healthy bowel movements. Micronutrients and antioxidants. So think about making a rainbow on your plate. Berries are super great for antioxidants, and they're a low glycemic food, meaning that it won't spike your blood sugar whenever you eat them. Think about peppers and leafy greens and eggplants. All of those colorful foods are full of antioxidants, which helps your cells to be the best that they can be. Hydration is also important, and then typically avoiding SAD. SAD is an acronym for the Standard American Diet. The Standard American Diet is harmful to us because these are nutrient deficient foods. They don't have the nutrients that we need. They're empty calories, so they're not even helping us to maintain our appetite, and they cause inflammation. So avoiding the greasy foods, the fast foods, the processed quick meals that are full of empty carbs or sodium. This can be really harmful to the cells and to the tissues as we're trying to work towards pregnancy. Stress. Now, stress is one of those things that it can be difficult for patients to really grasp stress because it isn't one of those tangible things like weight loss. Like we can look at ourselves and we can see that we've gained weight or that we've lost weight. Stress can cause changes in weight, but we don't actually feel stress. It can be really hard for patients to identify their stressors if they have a certain idea of what stress looks like. Stress isn't just insomnia. Stress is anxiety. Stress is worry. Stress is GI upset. Stress is heart issues or thyroid issues or issues within the hormones. All of these are different types of stressors, and I really like to talk to my patients about how the body deciphers stress. Our ancestors, for the most part, we have that cortisol response when we're like running away from a bear, right? I like to call it the invisible bear nowadays. We're not running away from bears anymore, but we still have that stressor, whether it's arguing with our partner or worrying about finances or the state of the world or your career or whatever that may be. Stress causes inhibitory effects on the reproductive system. When you are in a state of stress, your body is saying, this person isn't in a place to actually grow and maintain a baby right now because they're running away from a bear. And that bear can be all of the things that we talked about. So this is why stress and addressing stress is really important with fertility. Specifically, a lot of women who have been on this journey and who have been on this journey for a while, they're stressed about it because this is something that they really want and it isn't happening in the way that they thought that it would. So worrying about the infertility is another way that stress can just really wreak havoc on our endocrine system. How do I treat stress? So one, talking to the patient and really getting to know them and figure out what does that stress load look like for them? How are they experiencing stress? How does that show up in their body? We use herbs for this. Again, I love herbs. Herbs are really great for helping with stress management and anxiety and depression in particular. Glandular and nutrient supplementation, so actually giving the patient either adrenal support or thyroid support, giving them other nutrients that they need so that those organs can work optimally. Amino acids can be really helpful. Acupuncture, I love. Acupuncture is an energetic medicine, so it works a little bit deeper than like nutrition or hormones or supplements. Meditation, having a spiritual practice, yoga, and hobbies, all of these things are really important in reducing stress and helping the person feel just like their best self. That's important with pregnancy. It isn't always about the reproductive system. It can be other mental, emotional things that are going on. So making sure that we address that. Again, treat the whole person is important as we move forward with trying to become pregnant. Exercise. So I want to change the narrative around exercise because a lot of research around exercise and a lot of what we know about exercise is typically geared towards men. Men and women are very different physiologically and hormonally. So what works for a man doesn't always work for a woman. I've broken down exercise into 3 things that I want you guys to remember. So remember intuitive exercise, which just means listening to what your body needs during the different phases of your cycle. So 1, listen. What is your body saying? I know there are some women, myself included, who like to just go hard in everything that we do. And even when, I'll speak about myself so that I don't project onto other people. But for myself, there are times when I don't want to do anything, but I still have this voice in the back of my head saying, you need to go to the gym. You need to run 2 miles. You need to be on your mat, even when I feel that I don't want to do those things. And I think this is a really important piece in starting to heal ourselves and to start developing a relationship with our body, is listening to our body. During our cycle, our hormones are fluctuating. And depending on what's happening with the hormones, that can change how we feel. So listening to the body is really important. If you are tired or you don't feel like you have it in you to go to the gym, sometimes it's more of a benefit for you to do something else than to do a more aggressive workout that you may be used to. That is another form of stress. Workout is a form of stress. We have good stress and we have bad stress. If you're doing excessive exercise or you're doing a lot of high intensity workouts, this can cause more stressor on the body. Again, that's an invisible bear. So your body is saying, okay, we're running away from something. We're not in this space where we can grow and maintain a pregnancy. So we want to watch out for that and make sure we're not shooting ourselves in the foot with the exercises that we're doing. Variety is important. So I'm all for weightlifting. I'm all for running and doing cardio and doing those high intensity workouts. But I also really encourage yoga and Pilates and Tai Chi. Those are more of a yin type of exercise versus a yang exercise, which are those high intensities. We need all of it to have a really well-rounded structural system and muscular system. We need different forms of exercise. So having that variety is really important, and it'll help you to not get bored with what you're doing. And then last and most importantly is the resting, which ties into the listening part. Rest is so important, especially if we're experiencing high stressors in other parts of our lives. This is how our body restores itself. This is how we come back to ourselves, is through rest. And I honestly have found in my clinical practice that a lot of women are not getting enough rest that they need, either from career obligations, relationship obligations, or being a mother. There's always other people and other things that need us, but it's really important that we start to prioritize ourselves and our health, especially if you're on this journey with infertility. Rest is really important. Okay, so male infertility. So 35 to 40% of all cases of infertility stem from male causes. Let me say that again. 35 to 45% of all infertility cases come from male causes. This is almost equal to female causes. Again, I want to shake up this narrative that we have around infertility, where most of the conversation focuses on female infertility. But there are a lot of things that can go on with your partner, if you have a male partner, that can be contributing to your infertility. So really similar to female, we have structural abnormalities, hormonal imbalances, nutritional deficiencies, environmental burdens, genetics, and then certain medications that can affect the male's fertility. So how do we work this up? We do full comprehensive labs. We want to see thyroid. We want to see their sex hormones. We want to see their cholesterol. Do they have enough fat to make the hormones that they have? What do their adrenals look like? What does their vitamin D look like? So we want to do full labs there. We also have specialty labs, so testing heavy metals. If you have a partner that is in a more industrial occupation, like in the oil fields or with airplanes or a mechanic, there's a lot of heavy metal exposure in those career paths, and that can affect fertility for sure. A micronutrient panel, and this can be helpful for men and for women. This just helps us to see, like, what does your vitamin status look like? Are you getting enough of your B vitamins? Are you getting enough of your antioxidants? This is how we get a closer look at your nutrients, and then we can address those deficiencies through your diet. Physical exam, so actually looking at the physical reproductive organs in a man. Is there any abnormalities or any defects in the penis or the testes? And then doing a sperm analysis, which I highly, highly, highly recommend to couples who are experiencing infertility. I really like this pictograph here because it's showing us different factors that are affecting the sperm specifically. So on the left side here, it talks about environmental lifestyle factors. So drugs, antidepressants are a common factor with infertility. Also, testosterone. So there are some men that start to supplement with testosterone for various reasons. Testosterone can cause low sperm count, so that's something to be aware of. Smoking, and this doesn't just mean cigarette smoking. Anything that we are combusting and then inhaling causes oxidative stress to the sperm. So something else to watch out for: pollution and radiation, so environment. Common diets that we see with that I see with some of my male patients is diets that are heavy in animal fats. So the barbecue, that can cause some difficulty with the sperm. Diabetes, so getting high animal fats or too many sugars or too many carbs. Cancer definitely can cause infertility, especially when we start to do radiation treatment or chemo. So if you've had a partner who's had a past history of cancer, this can be a reason that contributes to infertility. And then systemic infection. So all of these things influence the integrity of the sperm, which can cause infertility from a male perspective. So how do we treat this? Underlying the pathology, what is the root cause? What issues or what factors does this male patient have that could be contributing to their infertility, and how do we address that in the clinic? So this diagram here is just showing us some different micronutrients that males need for their sperm. A lot of these are very similar for women as well. So selenium, zinc, glutathione, which is our major antioxidant in the body, vitamin D, vitamin C, another really important antioxidant, folate, which helps with our DNA synthesis, which is really important for passing on genes to your baby. And then vitamin A, copper and manganese, coenzyme Q10. All these micronutrients are really important. And these are micronutrients that we test for when we do those specialty testings. Toxins. So again, men are not immune to environmental toxins. In very similar ways that toxins affect female fertility, they also affect male fertility. Okay, so this is showing us different ways that the sperm analysis helps us to decipher what's going on with the sperm. So when we look at sperm count, how much sperm do we actually have swimming around? On the left, on the blue side in the first circle, you see that there are a lot of sperm. That's a healthy sperm count. On the right, on the left, on the right in the yellow, we see the low sperm count. You see that there are much, much less sperm swimming around. So that's one thing that we're looking for in the sperm analysis. Another thing that we're looking for is sperm morphology. Morphology is another name for the structure of the sperm. So on the left, on the blue side in that second circle, we see where the sperm is nice and healthy. It has that nice, healthy gland and a nice tail that helps it to swim up the vaginal canal, through the cervix, and into the uterus. When we look here on the right, the abnormal sperm, you see that the shape is just not healthy. The tail is a little bit curved. That isn't supportive of swimming for the sperm. So we look for that. What does the sperm actually look like? And then we look at sperm motility. So how well does the sperm move? If the swimmers aren't good swimmers, they can't get to where they need to go. So we want to make sure we're looking at how much sperm do we have? What is the quality of the sperm, and how well do those sperm move? Okay, guys, so this concludes the second part of the webinar series. There is so much more to talk about whenever we're discussing infertility, but I wanted to give just a quick 45-minute overview of some things that I see in clinical practice, and then to give you some different perspectives for things to look out for or to consider if you happen to find yourself on this journey. So now we will open up questions. Is it possible to get copies of the slides? Let me think about that. I do want to start sending out some freebies after each webinar to give you a summary of what we talk about. So I can't say that I can give you copies of the slide, but I will send out a handout, like a OneNote sheet of the takeaways, the important takeaways that I think are important from this talk. Thank you for that question. Does anyone else have any other questions here? I'm going to refresh our chat box to see if any came through while I was speaking. All right, if we don't have any other questions here, I do want to mention one more time that here at Living Wellness Medical Center, we offer a free 10-minute meet and greet. This is an opportunity for you to share some of your health concerns and an opportunity for me to share my treatment approaches and to see if we're a good fit for each other. You can schedule that free meet and greet online at livingwellnessmedicalcenter.com. That's all one word. Or you can schedule it by calling our front desk at 480-588-6856. So there is still one more part of the webinar series that I am going to discuss. That webinar is going to be on November the 13th. So 2 more weeks from now at the same time, and during the third part of the webinar, we're going to be talking about menopause and how you can navigate into that transition easily. Okay, I'm really excited about that one too. So if there are no more questions here, we will wrap up our second part of the webinar series. Thank you so much for giving me some of your time today. I look forward to seeing you in 2 weeks for the next webinar, and I hope you have a great weekend and a happy Halloween. I will see you guys next time. Bye-bye.